So good morning everybody and welcome to tray 4 of this webinar series by Government Homeopathic Medical College Bhopal in collaboration with Homeopathy 360. This is a 6-day free webinar series on bright talks by eminent homeopaths organized by Government Homeopathic Medical College Bhopal and Homeopathy 360. So before I begin, I just want to thank all the people who are behind this webinar series, all the coordinators, all the esteemed guests, as well as all the esteemed speakers who are with us, and they have contributed to this webinar. So I welcome each one of you to this webinar series and day 4. And I want to thank Sri Ram Kishore sir, Dr. M.K. Agarwal sir, Dr. S.K. Mishra sir, Dr. Babita Srivastav ma'am, and the coordinators of today's webinar, that is Dr. Santosh Hande, Professor HOD Department of Psychiatry at GHMC Bhopal, and Dr. Vijay Kumar Baraya, Professor in the Department of Community Medicine, GHMC Bhopal. So I welcome each one of you. Also, I want to thank my team of Homeopathy 360 as well as Manish Jain, the director of VJain Publishers, who is behind this webinar series. And also, I would like to gist you all about this software that you have a chat box on your screens wherein you can type your questions and send to us by pressing the button next to the box. So, we'll be running a question answer session at the end of the webinar. So you can clarify all your queries during that time. Also, I know, I think everybody knows about Homeopathy 360. It is an online portal for publication of all kinds of material, events, job vacancies. So I would like to invite all homeopaths who want to contribute to the fraternity as well as get their articles, their research papers published on the website. So, website or in the peer-reviewed Journal of Homeopathic Heritage. So you can mail me the same at yashika@homeopathy360.com, or you can directly upload on the website. For Heritage, you can mail me at hheditor@bgen.com for publication of your research papers. For the guidelines and everything information, you can visit the website of homeopathy360.com. So we are glad that you all have joined us today. So without wasting any more time, I would like to hand over the session to the coordinators of today's webinar. That is Dr. Santosh Hande as well as Dr. Vijay Kumar Baraya. So I would like to hand over the session to you, ma'am. Over to you.
Good afternoon to all of you. Today is the fourth day of 6-day webinar series 2020 organized by Government Homeopathic Medical College Bhopal in collaboration with Homeopathy 360. Today's webinar is on the topic, on a very interesting topic, preparing homeopath for new pandemic of mental health in and after and COVID-19. First of all, I just want to welcome Honorable Sri Ram Kishore Kavre, Honorable Minister of Ayush, Government of MP. I welcome Dr. M.K. Agarwal, Secretary Commissioner, Directorate of Ayush, MP. I welcome Dr. S.K. Mishra, Principal and CEO, Government Homeopathic Medical College, Bhopal. I also thankful to Manish Jain, Director of Beach and Publisher, who has given us the opportunity to organize this webinar. So I welcome all of you. I just want to give a few words about our eminent speaker, Dr. Manoj K. Patel. He is a Director, Community Health Services, Dr. M.L. Thavle Memorial Institute, and he is Professor and HOD, Department of Secretary, Dr. M.L. Thavle Memorial Institute, Palghar. So he's an eminent homeopath, and he has got a lot of knowledge, and he is an international figure who has given so many, who has conducted so many workshops and received a lot of awards as a best homeopathic physician and best teacher award. So I'm not making a delay, and you can listen him directly and get the benefit of his eminent knowledge. Thank you. And so please, Dr. Manoj Patel.
please on your audio, sir.
Now
Okay.
audio is on.
Yes,
Fine.
sir. Thank you so much. Yes, sir.
Yeah, I'm extremely thankful to Dr. Santosh and Dr. Ajay Parihar for giving me this opportunity to share my knowledge. It was my great visiting Bhopal College and the dedicated and enthusiastic staff. Friends, I'm going to present to you one of the most important part of homeopathic practice, not only personal practice, but all institutions and government institutions. And I'm so happy that head of the governments are also part of this team. I'm extremely thankful for them to spending their quality time for listening to this presentation, because what we are going to now handle is not going to be one person's job. It's a teamwork which is required with its dedication. So I'm dedicating this presentation to all my dear COVID warriors, some of very, very good friends we have lost in this battle while on duty, and their family members who have allowed them to do this work with their devil. It's like working on a front, like a warriors, and we dedicate entire presentation to them. And we have to refine our homeopathy to an extent that we don't have to lose our great friends in this war. Friend, most important part which is there is which I'm going to present to you is a uniqueness of this particular COVID-19. Specifically, it has so many variations that almost every day there is new news, including WHO, including big developed country. Everyone is lost because this presentation comes in a very unique way in each country, each state, each city, each family, and each individual. And this, I would like to dare to say, it is COVID-19 spectrum disorder. The only science which has expertise in individual care will be able to survive and will be able to do best in this, because every case is unique, every case demands unique attentions, and we are 250-year-old science with experience of individualization. The secret is individualization. And in this secret, the most important part which individualization is patient's mental health. If you have learned to identify unique aspect of mental care, you will be able to individualize this much better, and we will become better prepared to take this challenge. Friend, I'll take this presentation to almost 5 parts. First part, we will look into fear, phobia, worry, not actual experience of virus, but experience of fear. What is going to happen if I go out, if someone goes out? All this fear, a large community is covering that. So 2 sample cases I'll present to you of a different age group and species, gender. The second part will be actual experience and how mental health is during that time is important to study. Third phase is resolving phase, when people are recovering, but there are still doubt, there are still suspicion, there is, and not only in that individual, but overall medical fraternity. The fourth is most important part, and that is we as a homeopath, not only our homeopathic globules and medicine, but we as a homeopath and our homeopathic institution has a major role to play. So I'll share with you preventive aspect of homeopathy, which is very unique to us. And fifth most important part I'll present to you is of physician heal thyself. Unless and until we ourselves are not healed inside, we will carry forward our anxiety, our fear, our uncertainty to all our patients. So this fourth and fifth dimension we will present, and I hope all of you will travel with me with its required speed. Friends, WHO says that it is going to be a greatest challenge, and that is post and due to quarantine, there is loneliness, depression, harmful effect of alcohol, drug, self-harm, suicidal behavior, all is going to be very, very up high. And we have to be prepared as a homeopath to handle this aspect of our care. Friends, very few people know that 1 in 7, this is, I'm telling of 2017. This is survey done by authentic source, and they say that 1 in 7 Indians were affected by mental disorder of varying severity in 2017. Depressive disorder, anxiety disorder have contributed maximum. Daily means people's ability to function was so badly affected that we will now see post COVID as a psychiatric pandemic, the new pandemic, and which has no end. Dear friend, there is end to COVID-19. But if mental disorder sets in, it is one of the chronic, long-lasting. And the best sign is to prevent that. And best thing is to equip ourselves with a better training. And I'm extremely thankful to BJ and an entire group for organizing this so that we understand, value all homeopath, why we have to train ourselves into this. Otherwise, this will have its own impact. Previous study of pandemic, which earliest pandemic has shown all anxiety, fear, depressive sense of loneliness, sleeplessness. I think now we are already seeing this in 4 months itself. This is very fast spreading. And we are already late if we don't rise in time to handle this pandemic stress. Sudden disruption of life under not our control, fear of contracting infection, collective grief, losing people. I know one of the family which very close to us, we have lost them, their father-in-law, mother-in-law of young homeopath. And you can see that the trauma which they go through. So the collective grief associated with mass hysteria, and that is added by media. So this is something which needs to be studied, how it is influencing our mind and how it is influencing our uniqueness. And every reaction is unique. And this uncertainty has to end. And most of the phone call comes to us, doctor, when is this going to end? Friends, this COVID may end, but mental may need long handling. So anticipating mental morbidity is important. Extreme fear and uncertainty. I'm presenting cases to you. Lowered perceived health. One's own health needs perception. Negative social behavior, reactions in terms of insomnia, anger, health risk behavior. I'll tell you one of the case in that, how people become reckless and mental health disorder post-trauma, losing close ones, and what happens to us. I'll show you one of that case also. So I'm starting with my presentations of cases. Importance of knowing mind in all these dimensions is critically important. I hope everyone is with me, and I wish that all of you please note down. My speed will be fast. I give small posts for your decision making. So notes and paper, pen will be helpful to you to be very involved in the entire presentation. Part 1, I'm presenting an imaginary aspect, the fear which is not normal, fear which is just born out of imagination. The second part I'm presenting is infection. Third part I'm presenting is post-infection recovery, and fourth is preventive role. I told you already, make notes. You may have certain questions, please note down. I'll spend some time with you to answer some of the queries. Case 1 is of a boy who refuses to go out of his room. I received phone call from father saying my 11-year-old son has turned inward since the pandemic of 19. He doesn't allow any one of us to step out of the house, even for essential needs. He becomes extremely fearful to the point of phobia. Friends, children are very badly affected by media. And this is something which have to be taken care, that how to keep them away from this negative news, because news are all full of, most of the time, negativity. He keeps telling his father that he has COVID. For even his cold, for even his sneezing, which he has a chronic allergy problem, he feels everything is because of COVID. See, Small notes which I have made: that family history of depression to paternal grandmother, and recent history of tuberculosis. All this is important to note for homeopath, because that decides the soil, that decides the miasm which is responsible for genesis of this sensitivity and morbid sensitivity. What is this child suffering from? His child's fear is proportion to the stress. Whether this particular age group is really badly affected? No. The child has a partial information, child has a scary information, and he is extremely sensitive. That is one of the reasons. So we have to understand the sensitivity and sensibility and vulnerability. This aspect needs to be understood well, that who are vulnerable to infection, who are vulnerable to phobias, who are vulnerable to depression. And that will allow us to understand the activity, reactivity, and hyperreactivity. This entire COVID is all about these three dimensions. We will find asymptomatic, we'll find mild people, we will find moderate reactivity, and we will have hyperreactivity that suddenly they have gone into cytokinic storm. So it is important to understand mind-body relationship of psychoneurological axis, and I'm not going to spend a lot of time. For all my students, you must read this, that psychoneuroimmunological axis is important to study. We call it PNI axis, and how stress affects entire system, how stress influences hypothalamus, high in return affects sleep, acid peptic balance, as well as stress management. So stress can be conceptualized as the event disrupts our equilibrium. Stress is response to an individual to demand he or she perceives, which is taxing him. Stress is a very, very imaginary if you are understanding that if you are hypersensitive. But all stress are not negative. There is need to have small eustress, which allows you to function well. So it is important to find out how this eustress turns into suddenly a stress which is not able to control. So vulnerability aspect needs to be studied. So fear of getting infection. Now this is very, very interesting. The child has got this, was born with overprotection. There is a sensitivity in this child who cannot tolerate any quarrels between mother and grandmother. Sas or Bahu, he cannot tolerate any sound rise or any quarrels in family, and he gets scared, he isolates himself. He's a very chilly patient. He loves eggs, he loves pencils, indesirable thing. He perspires profusely, specifically on his head and other area, and recurrent respiratory allergy. So you have a background availability with this phobia, and it is important to now go back to rubric, and a very interesting rubric. This is important to understand that we have baryta carb, Bellispur, Calcarea, Bovista, sulfur, lachesis, medorinum, netramur, silica, syphilinum. All these constitutions are susceptible to or vulnerable to this fear factor. It's not a real experience of this, but just fear. So it was very clear for me. Calcarea carb was a remedy which is emerging. I have given him Calcarea carb. It was a very early case. You know, we had a eclipse at that time. So I explained father how to come out of this. These are very important role. Not only remedy, physician's role is critically important. Physician must look into this aspect, and that is counseling patient. So this child was handholded by father. I told him that you don't have to make him worry into this many. There are so many people going out and helping by taking proper measures. And हमारे में कहते हैं कि दे दान छूटे ग्रहण. So whatever you can do little bit for this society, start doing that positive thing rather than sitting at home and remaining in quarantine. Take all protective measures and help poor. So those days we had Bombay faced major migrant issue. So his father went out and helped migrants, and child started going with him, and he became a little more stronger. So Calcarea carb and better resolution helped him. A small case I am presenting to you of generalized anxiety, how this underlying anxiety patient are being affected. Daughter studies in New York, and you can understand what happened in New York at that time in month of April. So she was extremely worried. She was worried about herself, and she started developing certain physical symptoms: tingling, numbness, formication in entire body, giddiness, dizziness, sleepiness, and no sleep. So, and her thirst was decreased with this anxiety. Initially, I thought gelsemium will help. I gave her gelsemium. She was partially better, but she developed sleeplessness at 3 a.m. early in the morning. Calls every morning to find out whether she will be all right. And she went on asking me, when is this going to end? So there is a continuous apprehension, anxiety which comes up. So post gelsemium, I gave back her original constitutional remedy, that is Kalikab 0/4. I gave 3 powder, and friends, since then till now it's 1.5 to 2 months. Only she called twice for her follow-up. So this is power of homeopathy. Bit of counseling, bit of deep acting constitutional remedy, and story will change. Now I'm going into a very important area, and that area is of knowing mind during infective stage. The objective of presentation is to how very characteristic mental state triggers this mechanism of totality. Not that emotional reason is responsible, but if you are vulnerable, if you have a virus inside your body, and if you are emotionally disturbed at that time, there is all possibility that your asymptomatic presentation may go from mild, moderate to even severe. So mental health and mental state plays a critical role in helping patient to recover, as well as deteriorating the state if it is going in from bad to worse. So study all the characteristic evolution is very important. Creating totality using 3 characteristic of mind, body, and time is very important. Totality, totality, and totality. There is no other alternative to similimum at that given moment of time. Experiencing rapid, gentle, and permanent cure, which is mentioned through patient's own experience. This man is 62-year-old, very vulnerable. He's a pharmacist working in reputed hospital. So his pharmacy is hospital-based pharmacy. He was home quarantined from 8th May to 15th. And then very interesting thing happens. While during home quarantine, everything was no symptoms. Everyone said to him that nothing to worry since you came in touch with some of the people in the hospital, be in quarantine. On 16th morning, he got news that his beloved accountant, who is younger than him, 38, 39-year-old, passed away because of COVID. And that has really upset him. And then he developed COVID himself. On Monday, he developed fever, all investigations done. On Wednesday, his D-dimer level was already 1101. It's on rise. His IL-6 level has gone to 30.31, and his HRCT showed COVID lung. All the parameters were saying, and he was shifted to hospital on Wednesday. On Thursday, Friday, in spite of hospital and or best of the care, all the required medicine, standard protocol, his health was deteriorating by Friday. And on Friday, I received phone call, and he said, very interesting aspect he shares with us. I'll try to see video if can be shown to you. If it is audible, visible, just let me know. If it is not, I'll share with you what is being shared by patient.
Sir, can you please make the volume full?
It is full volume there.
Okay.
It's 100.
Okay, sir.
He is telling that he was quarantined and he's got the bad news of his. his beloved accountant passed away. This is testimony part. Friends, very important aspect. Even if you couldn't hear, it's very important for you to just a minute. Where is gone? Do I have? I'm audible, visible?
Yes, sir.
Okay.
Yes, sir.
Okay. Now my slides are visible.
Yes, sir, your slides are visible. Wait, I'll do it for you. You can stop the screen share. I'll start this slide for
Okay.
you.
Okay. Fine. So I'll start slide. Again, I have to go behind.
Yes, sir.
Perfect. Perfect.
I did it.
So fine. Thank you for technologically this I'm not so well. Uh, Friends, I told him after entire detailed workout that he will be all right in 2 days. I don't know how I told it, but I was so clear, and you will know why I was so clear that he will be all right. And friends, from where this confidence comes to homeopathy is critically important. What gives confidence to homeopath? How can he say to a patient who is slipping into crisis that you will be all right in 2 days? The only answer to this is totality. Evolutionary totality, cross-sectional totality, causation of mind, characteristic physical expression, study of basic temperament, acute and chronic state of mind, and repertorization properly, and mater medica and organon. All this, when you integrate, friends, you will be sure that your client will be all right. And this totality gives you confidence, nothing else. You can't say I'm homeopath and I'll cure everything. But if you get exact totality, you will be sure to your client and will be saying that they will be all right. So he lost his accountant has affected his mind. There was a clear-cut mixed emotion of grief, sadness, and anxiety to extent of fear and phobia, fright. That what is going to happen to me now? I'm elder than him. My health history has something in my heart. So all this is likely to take me to bad situation. So it's very important. On second day of fever, this news, he developed this fever. So Monday he was asymptomatic. Now see the evolution in travel. Monday he was asymptomatic up to Sunday night. Monday onward, he started developing basic symptoms. On Wednesday, he was exhausted. On Thursday, Friday, all reports were deteriorated. But what was there inside characteristic was his causative mental state and increased hunger during fever. He liked that spicy food. He says that still I have a hunger and my taste has not gone, because he was went on checking taste, because a lot of people said COVID taste goes, smell goes. And he says, I love spicy food and my appetite is same in spite of fever. So I noted that this is very, very important. And keeping his mind and this concomitant in totality, I was sure he will be all right. So insidious onset and rapid progress into disease. This time dimension, as said by Master Boger, and his causative mental health. Integrating entire totality with this concomitant remedy was clear. You see, this is the commonest remedy emerging. Arsenic, phosphorus, bryonia, pulsatilla, calcarea, like previous case, glycasis and lycopodium and natrum mur. These are the group of remedy I have seen, and when you repertorize many of time, this is something which comes up most of the time. Choosing out of this one is very, very important. In this case, for me, phosphorus was very clear. His mental state and his concomitant, which was available to me in form of his increased hunger for spicy food. And this led me to phosphorus as a remedy. This was very, very clear. Moment he gave me totality, I said, you'll be all right. And this was given to him. Within 2 doses of phosphorus, he started showing improvement. And within 4 doses, his exhaustive feeling has gone. On 3rd day, he was discharged home. 3rd day, he was at home. Actually, on 2nd night, Saturday, he started treatment. On Monday, he was free. Friends, he previously told us that he don't believe in homeopathy because there are no scientific paper, nothing. And this testimony, he says something which is very interesting. You have to build confidence of community in you. And when I told him to share your experience, and he shared very beautifully. हाँ सर नहीं मेरा webinar चालू है मैं बोलो स्पीकर बाद में
एक पार्टिसिपेंट का करना है प्लीज आप करके थोड़ा
Friends, very, very important aspect of this sharing is important. Just a minute. Why this happens? Stop sharing किया मैंने. Hello?
See now, sir.
I'm going to next slide. His antibody was formed in very rapid time. I'll tell you some of the cases and very interesting aspect. The case 2, I'll go a little fast. Case 2 has an underlying personality. You have seen previous personality. Now the second personality, which is having infection. 57-year-old man with heart patient. He's gone through recently angioplasty. His blood sugar is high. He's been on medication. And on 6th July, he developed hoarseness when he called me. But actually, there is a history that his complaint started 2 days back on 4th July, an Independence Day of USA. Like cold water, he liked, but it used to aggravate his complaint. Very interesting behind personality. He went on telling, "ये COVID सब बकवास है, कुछ होने वाला नहीं है डॉक्टर मुझे." And he was working. He was going to his office regularly. He was traveling by means of available transport, and he was reckless. His wife said, "Oh, pagal ho gaya, kisi ka sun nahi raha hai." You see, there is one side people are scared, feared, the another side people are trying to venture out. There is an extreme reaction which is coming up. I am scared of this man who is reckless. You have to be careful with your history, your age. The child had an unnecessary phobia. This man is unnecessarily reckless. So it is very important that this mixed type of presentation will come to us, but all of them, like that child had a calcarea carb in deaf, you see what personality is creating, what type of symptomatology. So he was being prescribed on 6th July when he said hoarseness of voice, cold cough is coming up. I had a number of cases responded to phosphorus, and he was not giving totality properly. So in available totality, with my past experience of treating COVID, I gave him phosphorus. On 7th July, his CRP level started increasing. His test was positive. Then he was very, very scared. When the test came positive, he said, "Abhi kya hone wala hai?" So he was always in agitation. His fever was better, but it relapsed. His weakness was partially better. Again, the evening started showing weaknesses, and his dry cough increased. His SpO2 started going down from 95, 96 to 93, 94. Phosphorus 1M was given, but I was not that confident like previous case. I went on exploring totality. He was in touch with me. I took full responsibility of him. I was calling him 3 times a day. On 10th July, we get a very, very interesting totality. Like his personality, his cough. Very violent, very aggressive cough. And he says, मेरा तो फेफड़ा हाथ में आ जाएगा, बाहर आ जाएगा, इतना खांसी है, मेरा लंग बाहर निकल के आ जाएगा. So I took it as a characteristic cough. Specifically, he said cough was during fever with cold perspiration on forehead. So during fever, he says that cough will not come if I have no fever. Moment cough start, I measure and it is a fever. Very interesting characteristic. Weakness increased, sleep was restless. And see what happens to mental health. He started getting dreams of robbers coming in his office, tod ke loot ke sab leke ja rahe, and he gets up with panic with cold perspiration again on his head, as if death is approaching, and he feels that ये तो साला पूरी दुनिया को मार के ही जाएगा. This is his expressions. This was not dream. This was in his conversation with me. डॉक्टर आपको क्या लगता है ये साला सबको मार के जाएगा क्या? So his type of language, his type of behavior was very interesting to note. So I noted down everything into uniqueness: fear of death, world is going to end, dreams of robbers, violent outburst of cough, fever during, and cold perspiration on forehead, craving for sour, cold drink, but aggravates his cough. Putting all these pieces together, friends, I'm giving you 30 seconds or less than time. Put down what remedy you are thinking of. You can put up on chat box also. What is the remedy you are thinking about? I'll give you small repertoire tip now. During repertorization, you will find that the remedy like veratrum, silica, murk, natrum, phos, carbovage, alumina, cuprum comes up. I was thinking of cuprum, drosera, and veratrum in this type of cough. So ultimately, I kept mental health and mental concomitant, very important, dreams and everything in mind, opted to go for veratrum. In dreams of veratrum, it is very clearly written, world is going to end, and cough violent, fever during. Cough violent with type of outburst as if lung will come out. All this type of presentation is available in veratrum. Veratrum was prescribed 200, and you see the response of exact remedy. Within 3 days, this dramatically shows improvement. In 11th, he was better. On 4th, after 4 doses on 12th, he was much better. Then I stopped medicine on 13th. On 13th night, he developed again cough with fever, mild. I gave veratramol 1M, and he was much, much better. And he's completely all right. After he got all right, I gave him tuberculinum 1M, knowing his background history, basic miasm, and his very interesting aspect comes up is on 4th July, thing starts. On 18th July, we have a report of him tested positive for antibody formation. Friend, this rapid, gentle, permanent aspect, which we will discuss in research part when I'm taking it last, the impact of virus is not only mind affects the virus. Yes, mind affects the susceptibility, which I talked to you in previous 2 cases. Now see the reverse aspect. Virus affects the mind. Friend, this is also important mental health aspect, that different type of virus affects the neurons. They also affect the brain. So this is a very clear study which has happened where they are saying that virus has a lethal effect on neurons, and sometimes it does produce mental disturbances, confusion, I had such cases in my Palghar Rural Hospital where I have seen cases with typhoid psychosis, where patient goes into psychotic symptomatology during typhoid. So typhoid psychosis was a known. Typhoid psychosis is beautifully mentioned in our literature. if you open up, in Boger, in hyoscyamus, it is written very clearly that complaint of such type of fever can lead to brain derangement and psychological derangement. So it's very interesting. Virus affects your mind. I'm quickly presenting two cases. One case where patient was having symptoms of, is a 58-year-old man. See, the basic history is important. Diabetic, hypertension, and family history was also strongly diabetic. There is a strong history of cancer. So there is a tubercular syphilitic traits in this patient. His constitutional remedy was lycopodium. And given earlier remedies were antimony tart, antimony ars in past for his acute. So now in this presentation, very interesting thing happens that he has quickly developed all this typical COVID lung presentation. This case is presented by, I'm presenting from hospital care taken by my team from Pune, Dr. S.K. Fansalkar, our teacher, and his team has done extensive job in hospital, number of patients they have seen in hospital. So this case was admitted in Dinanath Hospital, Pune, and under hospital care, standard protocol treatments are going on. With that, these symptoms are still coming up: vomiting, fever, weakness, and his SpO2 was dropping. So case is going into a crisis if not handled well. So diagnosis, predisposed state, miasmatic state, all is important for homeopath to study. And in his further development, you see what happens. He developed peculiar symptoms of weakness, myalgia, sweating, and confusion of mind. We cannot distinguish between what is SpO2, BP. So when he was reporting on to his attendant, he was not very clear of what is he talking. So it was very alarming sign. Such cases can deteriorate very fast. It's already affecting their brain. So confusion of mind, fever during, thirst increases large, fever evening, ambithermal patient, weakness profound, body ache with fever. It's a typical presentation like we see in typhoid type. So remedies are China, Baptisia, and hyoscyamus. So for us, choice was very clear, as Dr. Fansalkar sir given him Baptisia, because of inability to think, mental confusion, specifically in the fever phase. So you have hyoscyamus also, but hyoscyamus intensity and type of deliriousness is far more different than Baptisia. And with this body ache in concomitant, we could see very clearly Baptisia helped him in just 3 days. From 27th to 30th, this is very well documented case in hospital, where hospital people said that we have seen very beautiful result when homeopathy is given together. The results are faster, is said by hospital authority from modern medicine. A case fourth is very interesting case. I'll quickly tell you same way. Patient developed symptomatology with confusion, but this time the totality was slightly different. Weakness, fever, dry cough, thirstlessness was marked, and sleep was very disturbed, and he was very angry. He was not even ready to talk with physician. Move up. In COVID, actually, you don't get attention. But here our homeopathic warriors were there involved and trying to take totality, and they refuses to give totality. So this was also taken into note, that irritability and anger which has specifically come up. In addition, there was continuous mental grumbling. This is not his original temperament, that is been said by family members. So keeping this in mind, anger, cough aggravation at night, he was very thirstless, hot patient, and easily expectorations. Keeping all this in mind, remedy was emerging very clearly: pulsatilla, antimony tart, and this, but the evolution is not like pulsatilla. The mental state is not pulsatilla. This mental state is more close to antimony tart. So apathy, easily annoyed, wants to be alone, peevish, all this is covered by antimony tart during fever and cough. So this has been prescribed very easily. Antimony tart produced result along with 1 dose of tuberculinum in between. It was a very rapid result compared to the state of susceptibility he was in. Friends, this is now part 3 of my presentation and a very interesting area we are entering into. Part 3, I'm going to share with you an aspect of knowing mind during rehabilitation stage. Understanding dilemma of the patient and coming from a very ignorant aspect of this virus. What happens to them post-virus? What happens to their mental state is unique, and we have a very beautiful literature. And friends, this virus is going to affect not only at the level of individuals, but largely at the level of society, their relationship, and the handicap which we are going to face. So all is going to add to your underlying depression, underlying anxieties. And this man had underlying depression. He was been referred by his very close relative, said that please take homeopathy. He was shifted to hospital after his symptomatology for the safety of observation. After seeing him, and his relative told me that he has gone through major setback in his business. He was a very, very low and very in a depressive phase. So his complaints were, he was positive, fever with body ache, fatigue since 3 days. GP gave him medicine, general practitioner, and he was still deteriorating. Fever with poor appetite, thirst increased with dry mouth. For me, choice of remedy was very clear. Friends, for you also it is clear. When you say business, business failures, thinking about business, and you are in this state. So remedy was been selected on basis of he was in hospital with the test positive, very anxious, and he was more continuously talking about that, Dr. Saab, I wanted to be in hospital, I didn't want it to infect others, my granddaughter specifically. And this is the dilemma a lot of old people go through. Now, once he was better, hospital told them to go to home. After bryonia, within 3 days, he was so much better, no symptoms, but he doesn't want to go to home. And remember, friend, his acute totality was bryonia. Bryonia patient don't want to go home. They are all the time asking to want to go home. So when he doesn't want to go home because there is an underlying fear that still he is infective and he will infect others, and there was underlying mood which was going down, which was not so much better. So it is very interesting to find out what is happening. So prolonged struggle of business, when I took all the details, I'll not tell you all this when I'm writing in 5 lines. It's always I spend 45 minutes with each patient once they are better. I take all the details from mind, body, characteristics. So the totality emerged was a prolonged struggle in a business, financial worry, feeling of being betrayed and disappointed in his business. Reserved person, very less speaking, prefers solitude, listens to music. He's a very good musician by himself. Intense craving for sour food. Vitamin C, went on eating more than required. Fear of contagious infection and in turn infecting others. This is a very interesting aspect. Let's see what homeopathy says about it. So when I repertorized, Natrum Moor, Aurum Moor was coming up very high in my mind. And I was in this dilemma to give Aurum or Natrum, but opted to go for Natrum with very interesting rubric that epidemic disease, and in that Natrum Moor is one of the remedy which he feels that he will be infected by it and infecting others. But when you open up very specific rubric where it is said that drug is very useful to people who are scared and worried that they will infect others, and only one remedy was written, was Aurum Moor Netronatum. I didn't have this medicine with me, but it was running in my mind continuously. I gave him Natrum Moor because in isolation, all lockdown, I couldn't find Aurum Moor Netronatum. I didn't have in my clinic. So I prescribed him Natrum Moor. He was better. 3 weeks plus 4-week point, he was gradually improving, went home. But underlying depression went on and on. Gloomy state was not giving me feeling that he's completely all right. So I reviewed everything, and after 4th week, I gave him Aurum Moor Netronatum. which was available to me now, in 200 potency. And he gradually started showing smooth recovery in his depression, and he restarted his business these days and feeling little far more better, very positive from that negative mental state. Friends, we have a major role to play in homeopathy in helping these people who suffers from anxiety, who suffers from depression, who suffers from phobias. And not only that, there are patients will come with a tremendous trauma, losing loved ones. Suddenly he is talking and he's not there next day. And many of the cases, as I told you, one of the case I just took totality in morning. He was father-in-law of one of my close doctor colleague. Took details in morning. In evening, morning when he talked to me, he looked that and third day I am doctor feeling better. And still people are insisting me to go to hospital, then I'm going to hospital. Then he went to hospital for all checkup. That night he passed away. And it was a shockwave to whole family. So this type of trauma is very difficult to handle. In 15 days, his wife passed away, who was also COVID positive, but she couldn't come out of trauma. And I couldn't reach up to her in ICU. So we couldn't treat her, but she also passed away. See the impact of this on a close people who go through this experience. A lot of people still discuss and debate. I think it is badaya chadaya hai, aisa kuch hai nahi. But people who go through this experience, they will tell you the different story. So it is that virus which produces different changes in your constitution, in your blood, constitution of blood, and post COVID. Now, huge discussion is going on about checking your heart, checking your brain, checking your all cholesterol, triglycerides, and everything, because these clots, mechanism of formation of clots can go and harm patients substantially. So we have a tremendous role to play in preventing this all aspects. So I'm presenting small aspect of homeopathic prevention. This case I helped to come out of depression. Now we will see case, very interesting case of one lady who was suffering from acute anxiety and anticipation. She went on feeling that I'm going to get it. Since long she was talking about that. And one day her husband caught it. Very interesting experience that she went on telling to people that ये तो मुझे होना ही है, and अचानक उसका husband को हो जाता है. That she was anxious that she also has it. She was COVID positive husband था, but symptoms has come to wife. Extremely anxious, nervous, prostrated, and her legs were trembling. She felt so weak, as if paralyzed. So much of anticipation, so much of anxiety. Mild fever, not major fever was there. Mild fever, dullness, head heaviness, thirstlessness, and immunity medicines she was asking for. And what was done was her tests were done. She was COVID negative. She was so relieved, but simultaneously I gave her remedy also. This is very important aspect to study. The cry of vital force is not just for that virus was positive or negative. The state of mind has decided that already she needs something or she will go into breakdown. When husband is in quarantine, there is most likely that she will go into major nervous breakdown. And she was asking for help. I gave her gelsinium. Anticipating illness, dullness, drowsiness, fever with thirstlessness, miasmatically much more soric to psychotic, sensitivity to comorbidity, and susceptibility was high. So only 2 doses of gelsinium was given, and she was much better. No symptoms. She took her husband's quarantine very well. She was better. What happens is, keeping above all factoring in mind was define her case. I defined case within 3 days. So within 3 days, I talked to her, found out her constitutional remedy. She was very conscientious, very responsible. Her menses were staining and offensive, and her nature is anticipating various things, and anxiety, clairvoyance, something is going to happen, all is part of her constitution. Keeping all these things in mind, keeping this rubric in mind, I opted to choose silica in this case. as a remedy constitutionally. So I gave on third day silica. She remained asymptomatic all through. Now see what happens. Very interesting study which comes up. When I have done test for husband's antibody, we have done test for her also antibody. Though she was COVID negative in her first report and her antibody turned positive. So in between she did get infected, but in spite of this bad state of mind, she recovered fast and her antibody was formed within 3 weeks. Now, this is the area which we have to study role of our acute and constitutional remedies and what it can do. So I'll share with you a very powerful case. Second case, a 65-year-old man, an industrialist, and went on saying, I have very poor immunity. If I catch infection, I'm going to die. He's very sleepless. Since 1 month, I'm uncontrolled. Since 1 month, his sleeplessness has increased. All the time he's awake. I'm diabetic, hypertensive, gone through angioplasty, very poor or very sedentary habits, and very poor in his immunity. This man is extremely popular. He is a public figure. He wanted to distribute all our medicine, arsenic, alb, and camphor to all poor people in entire vicinity. He approached me. Huh? So his poor immunity, and he was on iron injection. So he went on saying, Doctor, ये कोरोना मुझे हुआ ना तो मैं तो मरने ही वाला हूँ. So he was telling very boldly, but there was a huge anxiety inside out him. And he says, if this comes to me, मेरा body ऐसा कमजोर है कि मैं मर जाऊंगा. His worry, very interesting worry. His worry is not of death, but he is such a powerful public figure that he says that मेरा life का मकसद था कि मेरे funeral में सबसे ज्यादा लोग आए. People will be with teary eye will say that बहुत अच्छा इंसान आके गया, लेकिन कोरोना से मैं मरूंगा तो 4 लोग भी नहीं आएंगे. डॉक्टर साहब, मेरे बच्चा मेरे को अग्निता भी नहीं दे सकेगा और मैं मोक्ष ही नहीं मिलेगा मुझे. Now this is a pang of anxiety of this individual. It's not just fear of corona. Fear of corona is small. Here he thinks of that he will not be liberated soul. And he lived his life to do that. His purpose of life was to liberate himself through good social service. So I took whole case. He was born with a silver spoon, but still he worked very hard and he established his own name, not a name of parents. He was very workaholic, very dictatorial, very boasting about himself in his interview. I did this and I did that. But deep within there was a pang of anxiety. Lot of flatulence, sedentary habits, many girlfriends, but no affairs. He says that I was always afraid of sexual relations because my libido is very low. He had a dream of becoming philanthropist, and which he achieved. Making big name in society, which he achieved. And then he tells about this pang of anxiety. And we open up totality, anxiety, salvation about last right, religious rights, and you find homeopathic repertory reflecting these friends. This is beauty of homeopathy. When you open up mind, anxiety, salvation about, and specifically religious practices, you have a remedy on list. Ignatia, Lycopodium, phosphoric acid, Staphysaceae, and sulfur. For me, choice was very clear. Many of you, choice is clear. It's Lycopodium. I gave him Lycopodium. His sleep improved substantially. Following dietary measures, he's diabetic and everything. In coming weeks and months, I'm treating him since the lockdown period till today. Now, very interesting finding. Remedy was Lycopodium. Very clear to me. His driver, his son, and his close family member developed COVID, and his exposure was substantially high. And he was very anxious. He called upon me, Doctor, ab to lag gayi apni. And recently he lost his mother-in-law, who was also COVID positive. Friends, this case is a challenge to us. Can we prevent? And I went on using intercurrent tuberculinum once a week and lycopodium every day, and see what happens. Till today, this man is fit, no symptoms. And if COVID comes, I'm sure he will be asymptomatically better. This is power of homeopathy. We have to do. We have to study this from all the dimension and understand that how homeopathy helps to improve diathesis and vulnerability, a predisposition toward developing disorder. Your study should consist of entire genetic, biological, physiological, and cognitive abilities of every individual, including underlying personalities and temperament. Then only you get exactly remedy which Stuart Close says about vacuums or the vulnerable point which will get improved. And that is how you can study entire case from biological perspective. This is family history, personal history, medical history, and psychological perspective, and like what we have seen in last case, the social factors. People develop a lot of anxiety out of exposure to media, exposure to what is happening, and the way society is handling the entire virus. Everything affects to different vulnerability in the individual. Each case needs to be studied from this dimension. So this biopsychosocial integration is important, and how society also influences psychology and psychology influences neurology, and simultaneously a biology also influences neurology and neurology influences psychology. It's a trinity. It is an angle. It is something which is area which needs to be completely studied, and we as a homeopath are champion. Hahnemann in his entire organon talks about this biopsychosocial integration. If you open up his case taking, and he says on the very fifth aphorism that I want to understand patient's moral characteristics, domestic worry, his physical ailments, and his social behavior and society's influence on him. This is what he asks on aphorism fifth, that I want you to completely take case from these three dimensions. So homeopathy has studied this biopsychosocial. Probably we are the champion in study of this. For modern psychiatry, this is recently evolved model. But for us, this is 250-year-old model. And we as a homeopath should not be away from this study in quick, fast time. Quick, don't go into quick. Well-being is designed by this particular dimensions of Trinity. And I will also add in finally, this is study model, but very important dynamics is of spirituality. This is studied model, but spiritual dimension is critically important. If you grow spiritually inside better, your mental health will be still far more better. So my teacher, I'm extremely thankful that he taught me this. This value I would like to install in every homeopath. Each case is important, and each case from child to even old person, take in detail. Take it from this model which I am presenting to you. This is I learned from my teacher. Study entire constitution, irrespective of common cold. The smallest complaint, you might see Allium cepa may help this patient, or a Sabedilla will help her cold, cough, and cold allergy. But don't miss out complete case taking. This is the only thing which will help you to build an individual which is very strong in the community. And as a homeopath, we have a role to play in community. It's not only community is important. Every individual who is healthy builds healthy community, and healthy homeopath builds healthy homeopathic community, and healthy individual makes healthy community. So we currently have a huge role to play in improving this community sensitivity. What is happening in the world over? If you try to understand from who are the vulnerable people or aftermath, you will see all children, adults, jobless, homeless, persons with diagnosis of various illnesses in their background. So there are huge list of people in community which needs homeopathy as a preventive support before even they go into infective stage. Even if they go through, after that also homeopathy has a role to play. So get ready to handle this possible psychological syndrome which is emerging in terms of anxiety, insomnia, depression. And this is another dimension. Mental health risk of working from home. It is badly affecting both. Initially, it looked very good. Everyone was happy to work from home. I can do my work. I don't have to travel in rush hours. I don't have to travel by road. I'm very happy. I'm not exposed to pollution. But see what happened at home. And everyone who's listening knows this. Might be chuckling and smiling. Children at home has created different level of havoc. They don't have playing ground, so they will create playing ground within the home. And you are supposed to help them for their homework for school. Teachers will say, school chalu hai, aap baaju mein baith ke padhao. Make them study next to you. So you work for your domestic thing, you are working woman, then you are working for your office, which has increased your workload, and then you are also working for your child. A very challenging time for all. This is going to affect even normal individual going into psychiatric breakdown. So I already discussed about it, the surge of cases which is going to take place. And are we ready? Are we prepared for this? Physical and mental, both damages are going to be collaterally same. The stress is affected with the job, insecurity, investment loss, and mainly all domestic cases which has increased. It was sometime romantic, my husband is with me, but staying too much of time of man and woman together has created lot of conflict, lot of area of domestic violence, and most important is that abuse, substance abuse and alcohol. And we have a tremendous role to play in withdrawal stage. I have fantastic experience in our hospital. So many patients come with alcohol withdrawal, and homeopathy has a tremendous role to play in helping patient to de-addict themselves, helping patient to come out of this acute crisis of withdrawal, because alcohol has created tremendous havoc in this entire quarantine people. Friends, when first time alcohol shops were open, there were queue for 1 kilometer to purchase alcohol. This is the level of addiction in the society, and alcohol has become medicine for distressing yourself. And that is the area of concern, because the point you withdraw, it is going to be very, very challenging. Another aspect is your lack of exercise, obesity, exaggeration of all your diabetes, hypertensions, socio-emotional responses post-pandemic, aggression, protest against authority. You will see suddenly it will rise. Start of slow and gradual recovery process. All these are going to be affected post-pandemic. Developing psychological resilience is critical in your all client, in yourself also. Using our strength, developing gratitude as an exercise. Accepting what we can change. Facing fears and maximum managing your anxiety. This is a technical skill which every homeopath has to take under to help their client to come out of it. If time permits and if we can conduct workshops on TV, I will definitely request Design Foundations to create a workshop modules for mental health, because it's going to be need of an hour. We are taking one very beautiful project in community, if we get approved, that creating health workers who will be helping mental health patients in the village level. We have shortage of psychiatrists. We have shortage of even homeopathic psychiatrists. But we all homeopath come together and we have a major role to play in preventing this mental health. So those who are in government I have appealed that let us create a module for community health workers in mental health. We are blessed with a center of excellence at Palghar, where we are running already a very beautiful center, but we are also going to run such training program. So well-being is well-rounded: environment, health, relationship, relating to your community. Be engaged, be in communication with people. Using all this platform, using this webinar, those who are attending this webinar right now, all are very, very important phenomena. And most important experience and very beautiful experience. I have treated 200 plus patients, 200 plus patient of COVID only on telemedicine. I am not in touch with patients. They are either at home quarantine, they are at hospital, and I am able to help them through mobile phone, through smartphone, and we are extremely in advantage as a homeopath. And specifically, if you have know-how of knowing how to handle mind and mental health, we have a major role to play with the help of telehomeopathy. And telehomeopathy has to be learned. It is one of the safest way. Initially, I personally had a problem because I always like to meet patient, relate to them. But once I started relating to them, even on small screen or on Zoom platform or available web platform, and we could connect well. They were also feeling very, very happy meeting us. And maintenance of record, documentation, everything becomes easy with telemedicine. And you document all this will increase your legal protection also. And it is reduces burden on secondary health system. Can you imagine the cases, some of the cases I have treated, vulnerable cases at home, has reduced burden in hospital. Some of the cases we are in hospital and we treated homeopathically, we reduce burden of ICU and respirator. So we have a major role to play in reducing health burden of our medical system. Pandemic has challenged nations. History is telling us most of the changes are coming during pandemic. I tell you, friends, I feel thank you. I feel blessed that I have everything in my life. But when I used to get up early in the morning for meditation, I was full of aggression. For what do you know? Because I used to read multimedia about the Chinese are invading, their handling of our soldiers. I was feeling this is the time, please come together. Why are you fighting? Why people come together and help, not come together and help? In place of that, why are you coming up with some conflict? Bringing about all the conflict in today's time. And somehow this happens. All conflict surfaces in this isolation. No wonder in this time people try to take an opportunity, a business opportunity, grab someone's business, make it mine, an animal behavior which comes up in us. And all this is seen in past. Most of the revolution, most of the turmoil has been born, including world wars, everything during past pandemic. This pandemic, you should not be surprised. We are going to go up to 2022 minimum. And we have to see a lot of changes which is going to emerge. And in that, we have a role to play. I had to really do meditation and pray to all the decision maker, including ZPing, including our leaders, that please God give them sense of balance and peaceful coexistence. We will be growing from globalization to more isolation. This is happening, and we have to fight with this. More control of government. You do this, you get hospitalized, you don't remain, you don't be here, because whenever you are in unknown situation, the control mechanism from outside increases. So better with homeopathy. We build inside us intelligence which helps us to adapt to this reality better. Global changes would need adaptation. Greater outlet on preventive healthcare, especially raising immunity, is important. All activity, including homeopathy, yoga, Ayurveda, and Ayush system, has a tremendous role in building up this immunity system. Moving off educational and healthcare on online platform, what we are doing right now, is very, very important. And learning to adapt to this, like I am learning this platform. I have learned something new, how to go by this platform. So every day there is something which you will be learning new to relate to people. Not everything was bad. Environment was beautiful these days. Rain is excellent. The greenery is differently green. The wild species are coming and trying to be closer to us. When we can't reach up to them, they are reaching up to us. They are on our streets. So this pandemic is not just bad or seeing it as something which is negative. I always call it as a Shiva Tandava, where all negative influence will be burned if we take Corona in a positive way. I begin with saying war, but I like to end up saying adapt to Corona, accept it, make changes inside us, make changes inside your state, in your country. This is Shiv Tandav, which will teach us to reform ourselves. And homeopath has a tremendous role to play in this. We don't complain about scarcity, but we have a tremendous power. People, trained teachers, flora, fauna. What we don't have in India. Let's come together. We have such a great philanthropists. We have such great institutions like our Dr. M.L. Dawade institution, B. Jain publications, our government homeopathic colleges. We have tremendous power to come together and work together and bring and make better India. And I'll say that homeopath can come in center. Most efficient healing system, most sensitive to human friendly. It has a comprehensive philosophical foundation. To an extent, my friend Rajiv Bajaj uses homeopathic principle in his Bajaj Auto to improve his Bajaj functioning. Most comprehensive healthcare coverage, including preventive, curative, and promotive aspect. So, friends, why not we revitalize homeopathy? We must train ourselves. Listening to webinar is adding to some stimulant, but we have to train by taking responsibility. That's what I learned from my teacher. Don't go away from. All young homeopaths, I'll say that please, if you get an opportunity to work in COVID world, volunteer yourself. Getting money is a secondary reward. Volunteering yourself and learning to handle this in hospital setup, where coming no conflict between allopathy, homeopathy, Ayurveda. Come all together, and homeopath can be a best integrating force, and they can change the scenario of health. At the individual homeopathic level, we have to practice through social distancing. I have created a whole beautiful glass cabin where my patients can come and sit, and yet my work has increased multifold in these days and have not reduced. So let us come together, build a new community of homeopathy, transfer our expertise and knowledge to even health workers, community health workers, train your people in family. I have so many community health workers who are working right now in small villages. I have so many community health workers in terms of housewives, and so many of my patients, they are working as an intermediary. They are the people who build confidence in community, that take homeopathy, and homeopathy will change your status of health during, during and post-COVID. So this is what it is. Homeopath, you have to dedicate. Then you will get very beautiful testimony. One of my patients, I told him, tell me about your homeopathic experience. I hope you can listen to this. I'll just try if I can share. If not, don't worry, I'll talk to you what he says. When he says, Dr. Manoj Patel, just listen to it as homeopath, and it will change, and it will bring a lot of smile on your face. Friends, he was going through massive distress because of business. His works were hampered. He's a creative man. Everything was distorted. His immunity gone down because of all business stress and worry to complete thing in time, and things were not happening. And you can understand what people must have gone through. And in his very, very low phase, he developed COVID. And he calls upon me through some of the relative. I don't know him at all. We are new to each other. See what he says. Friends, they are very, very happy. Happy with us for what we are able to do. Happy with us with our performances. Yes. Where is my presentation? Slide share. Okay. Can you come to my slide share? Yeah, perfect. Thank you. So this is what not only told to Dr. Manoj Patel. I give all credit to homeopathy. But simultaneously, I give credit to my teachers who built a value of being great homeopath, who cares for patient, who is side by his patient in his all crisis. It's not question of just giving homeopathy or allopathy or pure homeopathy or single dose or this dose or that dose. You are human being first. You be with your client, and they will teach you how to handle this. I don't want to boast, but I can say that this responsibility made me expert in this field in just 2 months' time with 200 cases. So taking responsibility is critically important. That will help you to deal with your internal worry, anxiety, aggression, and reflect on yourself and build the attitude of gratitude. Thank you for being a healer in this time. It's our time, our special time, and be fit to give your 100%. Thank you to everyone. Thank you to my institution, which has started now from 17th August. We have a COVID ward, 50 bedded COVID wing we have started in a homeopathic hospital. We have a team of doctors from modern medicine. All homeopathic PG students have devoted their time. We are running all the PG program in psychiatry. We are running PG in repertory, materia medica, philosophy, medicine, pediatrics. So all department students come together and work under the team. Team of Dr. Prashant and Devangini are running research project. And I'm sure, and I pray, and I wish all of you, let us come together and pray that we as a homeopath come out with exceptional finding of our way of treating COVID and its impact on homeopathic community in general. Thank you very much. I'm extremely thankful to Dr. Santosh, Dr. Ajay, and now team of BJN, my teachers, Dr. Anil Tiwari and Dr. Kumar Davde, and Team Enlightened Education, Dr. Jawar Shah, for helping me to make this presentation a little more better. Friends, I'm open for now question answer part, and anything you wish to ask, it will be great pleasure for me.
Thank you, sir, for this one lecture.
Yeah.
Thank you so much, sir. I request Dr. Santosh or Dr. Babita if they are with us. Ma'am?
Yeah,
Ishika,
we are
we
having
are
some
with
Yeah,
you.
thank you so
questions.
much. Yes, thank you so much. We can have a question answer session.
So, sir,
Yes,
you have given
Dr.
a
Santosh.
tremendous
Hello,
knowledge
Dr.
about
Santosh.
how to deal
Ishita,
with
we have a few
COVID-19.
questions.
But some students,
Please, one person at a
First
time.
of all, I would like. First of
okay,
all, I
sir,
would
I
like
am
to
putting
thank
the
Doctor.
questions which
Sir,
students
it was
have
wonderful,
sent
sir.
to me, and I'm
Bless
reading
you.
those
कैसे कोई
questions.
questions है क्या? What should we do if
Sir,
the children are facing
the first
anxiety due to the
question,
coronavirus?
sir, am I audible?
One such question is,
Yeah,
what should
go ahead.
we do?
Am I
Yes,
audible?
Yeah, you are audible.
Sir,
yes, sir.
the first question is from
Sir,
Dr.
first of all,
Ragini
I would
from
like to
Psychiatry
thank you, sir, for such
Department,
such
and
a
she has
enlightening
asked
lecture, sir.
how to
And there are two
maintain
questions. One
social
of the student
distance
is asking, what
without
should we do
distance
if the
in the
child, if the
relationship
children are facing
between two
anxiety
persons.
due to the coronavirus?
Most important part in human or any mammals is touch. So when you are not in physical touch, it's going to be a biggest challenge for everyone. All mammals, I'm telling you. If you see from fish who is coming from or anything, the body touch, the tactile touch is something which is critically important for human development. But in this given time, when you are worried or anxious or fearful about someone and keeping yourself in isolation is extremely dangerous. So what you do is keep in touch without physical touch is something, a trick which you will learn through modern technology. We are blessed with modern technology. You can always go out in a space which is permissible space together in a social distancing, can always communicate and relate, because this is very important. Only meditation or sitting in one room is not going to help all the time. Relating is something inborn quality of human beings, and relating, you have to find out different platforms to relate in that reference. And when you are very very sure, like in my family we are very very sure that none of us has developed symptoms or anything, so we are very close bond with each other. This is the time which I have said that I'm blessed that I have found one of the best time with my family.
Yes, sir, that's
Related, we cook together, we clean home together. So doing together, don't miss out at social distancing. And you are running on your own mobile phone, someone else is running on its own mobile phone, is going to be extremely dangerous isolation. So someone who is close to you, please try to at social distance relate. Second level is definitely communicating to people who are at distance through video and various things. I will say that more than relating, when you are relating only to information, is most dangerous, because too much of information has created too many problems, according to me. You will not believe. I will read what is coming as a question to my mind, not something which is instilled in me in the morning when WhatsApp I see, and there are provocative WhatsApp goes on, is misuse of media, and this media is going to eat away in spite of best of my training and best of my life situation. Morning, I'm very honest. So morning when I was trying to prepare for all these things, I opened up and suddenly one WhatsApp came that some people from this particular channel has went into someone's society and home for interview aggressively, invading into privacy. So I was so agitated and upset. Why someone is doing that? Now this is a very clear state that I was being provoked by that half information. And I tell you, if you want to provoke anyone, you give half information, and the provocation will come. If you have a complete information, 99% you will settle down. So media lives on half information. Media is not interested in truth. Most of the media, I'm not challenging all media, but most of the medias are interested in spice. So why are we victim of that? So we have to learn to keep ourselves pakka distancing from informations and pakka connecting to people whom you love in whatever way you can. Like you have not met your grandmother who is in Delhi or probably somewhere else in Madhya Pradesh or in Bombay or in Gujarat. Pick up phone. Stop saying, "Mother, you have a time never spent with her." So it is very important that relating to people is very important. Relating to information should be extremely filtered to specifically children, to specifically people who are idle and psychiatrically not well. Yeah, go ahead.
So
Sir,
there's
there is
one
one
more
more
question,
question regarding
and this
how to face
how to
the
manage
anxiety.
washing
You have already
hygiene without
answered,
becoming
and
it as an
how to make a
obsession of
person
washing.
confident and fearless during this pandemic. Um, this is one more question.
See, uh, the right method are coming up very beautifully in most of the good media. That how many minutes of wash is important and how frequently and when it is important. Before food, before going, when you come from outside. So anything else, just thought has come in my mind that something is stuck in my head, hand, is all sickness. Are you getting what I'm saying? And many of my patients, I told them, such patient to wear gloves and wash gloves again and again if you want, but don't wash your hand. Are you getting? Because you will
Yeah.
damage your dermis and other area of skin very much. So washing too much is also dangerous. So there is a requisite time, how much time you should wash, way you wash. Every videos are available. And more than that is to be very clearly told, this is much more obsession which you have to desensitize yourself to. And corona किसको ज्यादा vulnerable है? Today's presentation you are very clear vulnerability aspect. So I have so many children, I have counseled them and they were very happy that I told them that corona happens to these people more. Corona doesn't happen to female of this particular gender to age group to statistical study. So all going into phobia has no sense according to me. Some people can take risk. Who are able to take risk? Those who are not vulnerable. So their chances of getting infection and recovery is more than 95%. So those can go with proper precaution and out, and still if it happens, this has to be done. Then the second thing, when you come from outside to inside, that's the time for wash and cleaning and changing. So all these are small things which probably is very important, but I think people are doing it very, very well. I don't think so. I want to spend time on that type of questionnaire, but washing in OCD increases in this time is very true. And they all need good homeopathic medicine to reduce their underlying anxiety. And that will improve. Like I told you, that lady was calling me every morning for whether things will be all right. Now that patient improved after Kalika in its proper way of repetition, and now call has reduced from every day to once in a month to 2 times in a month. Are you getting? So homeopathy has a major role
Yes,
to
sir.
play in improving undercurrent of anxiety. Yeah.
Yes, sir.
So this is a
Yes,
question
sir.
from Dr.
Sir, one more
Neeraj. What are the
question was there. It was
psychological
very
effects of
important.
COVID-19
How to
on
deal with the
physician
pregnant
and
ladies
how to
with this corona fear. There was one more question somebody asked. There are pregnant ladies out there, and they're very fearful. Like, I mean, the corona infection and what is going to affect their babies and all, and they have a lot of anxiety, and which is very bad for their pregnancy also. So, how to deal and how to cope? What you have to say about it?
See, anxiety is normal. This anxiety has to be there. If it is not there, I'm worried. But
Huh.
anxiety be proportion to the stimulant,
it's
like pregnancy, certain type of precocious measure. Like you will say that since I am corona and my child will become corona positive, yeah, my infant will become corona positive. That statistical reality is very, very remote, very, very remote. So unnecessarily going into thoughts needs to be immediately confronted. That there are no such findings. Go to open all basic good literatures, PubMed, all related research, and you will not find that that has been found out barring few exceptional cases. It's not like an HIV which is transmitted. So it is very important to knowledge brings from darkness to light. And your job is to clearly read for it and talk to your patient and send the material. Like if you are asking me, I'll say Nimans has done superb manual on pandemic. I will send you the link. You can read it is freely available. I'll send it to you, Bijan and college. Please send it to those who wants to know any question related to mental health. It is published in April,
Okay, sir. Thank you.
and every
Okay, sir. Thank you, sir.
questions are asked in detail. Okay.
Okay. Okay, sir. Thank you so much. Sir, there is one very important
There's a
question, and
next
it I
question.
think it is
What should we
very,
do if children facing
very
anxiety
intellectual.
due to
How to handle the
coronavirus?
COVID cases with already pre-existing mental illness? Some patients are already
Yeah, I told you
delusional.
already. Aurum Mur natriuretum case had a depression pre-existing. So corona was
Yes, sir.
just one of the modalities which has increased, and finding the right remedy has helped. Aurum Mur natriuretum has helped that case to substantially improve in his underlying depression also. Corona just becomes
Okay.
a triggering in these circumstances, and isolation increases this because of corona. Asks for isolation, then isolation in depression will increase substantially. Another very interesting case which I had was a patient of psychotic breakdown, and he came to hospital saying मैं corona हूँ, and he was trying to reach various people closely and making them scared. So again, I took whole detail, and stramonium helped him so beautifully to settle his mental anxiety and internal disturbance which he was going through in this breakdown. Stramonium had a major role to play in improving this type of breakdown. Go ahead.
So this is the last question.
Lockdown, corona
Then
fear, and
how
its
can we deal
impact
from the
over
effect
the
of corona fear
interpersonal
amid
relationship.
lockdown and its effect on the interpersonal relationship?
Yeah, I think I partially touched this area.
Yeah.
Yeah,
Yeah.
you have almost all the questions that I'm seeing, you have already touched it. So this is the only one question I
So
thought
should
ki
we
the
go
effect of
on next question?
interpersonal relationship is a bit something different,
Yeah,
I guess.
but I feel that first never deal with outside, first deal with inside. To all listeners, including homeopath, this is a time where you are forced isolated. In this forced isolation, this is the time you have to spend time for yourself. Knowing yourself is critically important. Corona has provided this immense opportunity to know yourself. You will be surprised that so many people were scared that घर में servant नहीं होगी तो ये हो जाएगा, ये नहीं होगा तो वो हो जाएगा, फिर खाना 2 टाइम पूरा नहीं मिलेगा तो क्या हो जाएगा. All were anticipated, right? When we started living in it, gradually people started living happily with it. Those who were
Yeah.
in a good, and they could see that they can live life simply good in a simple availability. आपको पिज्जा नहीं मिला तो मर नहीं गए. तो आप the whole process, rather people have made their own home pizza which was not as good as outside, but then the process was more important than the outcome final of becoming that pizza. So the whole process is very, very important for all of us to first correct yourself, then you relate to others. Moment you try to relate to others to correct yourself, it will never happen. Interpersonal problem comes up because we don't know ourselves well. If you know yourself well, you will be very, 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 very empathetic to others. I know मौसम न कुटिल हल कामिनी कभी नहीं है, तभी मेरा relation with others will change. Me, with my environment, with my everything. Like always say that sense of gratitude is so important. Gratitude is not just for being homeopath. A silica जैसा substance can change, natramur जैसा pinch of salt can change the people's mental state. आप क्या कर सकते हो? You don't have role to play. If silica has something, so human, non-human, everything is important to be gratitude. And the most important, target yourself that you are in list of people's gratitude. At the end, when I presented that yellow video, where that man had tremendous gratitude. In his gratitude, he said, I wish him well, my dear doctor, I wish him well. So you are part of someone's gratitude. Live life like that. So simple. You be part of gratitude of someone.
Yes. Sir, I think most of the questions we have covered, and most of them were similar. So I think you have already covered in your lecture also the most of the things. So now Hande will take over, Dr. Santosh Hande. And thank you, sir. Thank you once more.
Please.
Santosh.
So I'm very thankful to you on the behalf of Government Homeopathic Medical College, Bhopal, for sharing the knowledge with us. And I would like to thank all the people who are directly or indirectly involved to conduct this webinar. I'm very thankful to BGN and Homeopathy 360 for the valuable cooperation. I'm also thankful to the whole team of GHMC. So you have given us stimulus to do the various things for the particularly for the community, for the society, and all. And we will try to follow all these instruction of yours to serve the society and the community. Thank you, sir. Thank you so much.
Thank you.
Thank you
So
so
thank
much,
you.
ma'am. Thank you so much.
Thank you, Ishika.
Okay,
Thank
thank
you
you.
for being such a great help.
I'm disconnected.
Yes, sir. Thank you.
So